Everyone.
Good evening, ma'am.
Good evening, ma'am.
From Ogun State College of Nursing. We'll be talking about advanced healthcare and public health professional program. I'll be talking about advanced certified caregiver training program, advanced certified mental health awareness, and advanced certified public health training. So we'll be training ourselves on some things tonight. The first thing we are going to talk about is foundations of public health. So what is public health?
It's not a...
Public health is a science and art of preventing disease.
Thank you.
Prolonging life and promoting health of population.
Just let me anymore. Yes, just be patient. It's a network. So she's going to join in immediately.
Are you hearing me now?
Yes, we can hear you now, ma'am.
Yes, we can.
Thank you. I said the emphasis on public health is on population focused. It is not about individual health. It's about group of people. It's about giving healthcare to group of people. Another thing is that it is prevention. It's about prevention. It's about promotion of health. And it's about health equity. That is increasing access of health to almost everyone by removing some social determinants that prevent access to quality health. And it's also about improving quality and length of life. That is what public health is all about. So let's go to the next thing. So the scope of public health is about disease prevention and control. How do we prevent disease? How do we, when there's outbreak of disease, how do we control it? It's also about health promotion and education. Public health is about promoting the health of population, like I've said, and also educating people on those things that can promote their health, prevent diseases, and ensure maximum health. It's also about environmental and occupational health. We are talking about the health of the environment, ensuring the environment is conducive for good living. Then it's also about the health of the place where we are working, occupational health. The scope also extends to epidemiology and biostatistics. Epidemiology is about studying of the occurrence of disease at a given time. And the biostatistics is the one that is about researching into those things that cause such diseases, how to prevent them on time. Then the scope also extends to providing of health services. Is about health administration and health policy, creating policies that will promote health, creating policies that will promote the health of the population. It's also about social and behavioral determinants of health. Like I told us the other time, it's about removing those determinants that prevent quality access to health. So the scope of public health also involves what are those things that determine the health of a population, such as age, such as the class of that person, the occupation the person is doing, the status of that person, the economic factors, the culture. Those are the determinants of health. So the public health also monitor this and they look into this. So what are the core principles of public health? The core principle of public health. Number one is prevention over cure. Public health is about prevention. In public health, we value prevention more than cure. We value preventing something, preventing the occurrence of that diseases more than cure. Then it's also equity and social justice. That is, providing and increases access to health to everyone, whether the rich or the poor, whether the educated or the non-formally educated. That is, providing the right thing that each and everyone should have. There is also about community participation. You involve the community at all levels of provision of care, not just that when you want to deliver the care, even when you are planning for the care, even when you are assessing the community, you assess with them. So you involve the community in the provision of their health care so that it can be part and part, so that they will appreciate it. Another thing is that it's also evidence-based practice. It's about conduct research, you look at it, what is this research saying? Okay, from this, okay, we can see that this is the next thing that we ought to do. It's not just about using witty knowledge. You conduct research, you look into it, okay, this is what the researcher said, this is what has happened. Scientific and systemic way of searching into a thing and developing new knowledge. So this is the new knowledge that will now be used for the practice. It's also intersectoral collaboration, that is, it involves many sectors. Like now when we are talking about climate change, it's not just talking about the industry, talking about even how it's affecting water production, talking about water, energy, and many other things, talking about agric, talking about food security. So it's intersectoral when we are talking about public health, because all these sectors has one impact or the other on the health of the population. Then it also involves ethical practice and accountability. So we have to consider this. What are some ethical issues that we have to consider when we are providing healthcare for people? The principle of beneficence, non-malfeasance. That is, you always do good, you don't do harm. Then you have to be, this is what we are doing, this is how we are carrying on. Everybody have to see, what are we doing? Now, the history of public health goes like this. Initially in the ancient civilization, public health is about sanitation and hygiene, whereby they tell people that they should ensure hygiene, both the environmental and personal. Then the sanitation of the area where they are living, ensuring that it's a clean area. Then by the Middle Age, it has been discovered that there are some things, there are some infections that could cause diseases. So they begin to quarantine those that may have diseases, or animals that may have diseases, or sources of diseases, in order to prevent the spread of such diseases. Later, by 19th century, whereby John Snow discovered that the transmission of cholera is due to the source of their water. So they now begin to look about, okay, let's now study more. How does this affect the health of the population? So what is the cause of transmission of diseases and infection? The epidemiology of diseases, that is how diseases spread, and how it occurs in the population. So they begin to know that, they begin to study that, they begin to use that to provide quality healthcare. Then later germ theory was developed that make us to know that germs are responsible for the occurrence of diseases. That it is not about, there was a time that they believe it is due to one spirit or the other. It is due to one, but later it's been discovered by pastor and coach that germs are responsible for the occurrence of diseases. Then in 20th century, it now begin to expand into maternal and child health. Now we begin to talk about reducing maternal mortality and neonatal and children mortality. Now extending it even to chronic diseases and non-communicable diseases, such as hypertension, diabetes, and many other things. Other one that is now being developed. So in this modern area, we are talking about non-communicable diseases, climate change. If someone first would observe, I talked about climate change. That is the area we are in now. How the climate is affecting us due to our actions and inactions. That is warming, global warming, causing the globe to get warm, thereby making it to emit some gases that are now affecting the earth and also affecting the nature, the environment. So we talk about global health, looking at it together. As we can see, UNICEF having is Sustainable Development Goal, UN. So this is how public health continues to emerge. Now, who are the people that are stakeholders in public health systems? The governments and ministries of health, the government of each nation, the ministries of health in that nation, our healthcare institutions at the federal level, at the state level, at the primary healthcare level, even the private institutions and professionals, the nurses, the doctors, the pharmacists, and as many people that are involved. Like I said, there is intersectoral collaboration. And even beyond the health, we now even having digital people be involved in public health, because we are not talking about increasing access to health through digitalization of health education and even delivering of health, like telemedicine and telehealth. So the community itself, like I told us initially, that our communities are we are to involve them, full involvement, participation. And the traditional leaders, they are part of public health system. The non-governmental organization and civil society, the academic and research institutions, the international agencies such as WHO, the UNICEF. So all these people, they have to collaborate together, and it has to be coordinated to increase the quality of health of the population. So these are the people that make up the public health system. And so all these people have to work together in order to achieve the promotion of health of the population. Like the other time when I was talking, I talked about some social determinants of health. That those things that determine health, like income and employment, and this is a great determinant of health, the income and employment. Sometimes those that do not have good source of income, they will not show up on time, even when they are sick or they are ill, making their health to deteriorate. Not only that, the quality of food that they eat, the quality of environment they are living, the quality of the house they are even living. So all these are determinants of health. Employment, it's from employment that we have income. The kind of employment that one is engaging also will determine the kind of income. Like we know there are some jobs that by doing them, those that are doing them earn less than 2,000 naira per day. So in such situation, with the situation of what is happening, how will such people cope with health? Like even how would they cope with feeding, eating good food, being able to access health when they need it. So that is one determinant. Another one is education and literacy. Like we said, that public health is about evidence-based. It has been researched and it has been found out many cases that with quality and higher education and literacy, people tend to have better health because they are more aware of those things that can deteriorate their health or could affect their health. You know, with education, people get more awareness about, oh, these are the things that I could do that will improve my health. These are the things that if I do could endanger my life. So the housing and living conditions, I've talked about that. Let's look at those that are living in some houses in Lagos. Like they were showing it one day. I saw people living on will I say on water or river, or I don't know, you know. And I was surprised. You know, they have to use boats to take them. And you see some people living under the bridge where, you know, a lot of things are being disposed of. So the housing and the living conditions also determines the health of people. Gender and culture. The culture too. You know, we have some culture that are really affecting health. Like we are talking about, we said that public health now involve maternal and child death. And it has been found out in researches that people in some culture tends not to be ready to prepare for birth. They won't prepare for their birth. Neither will they be ready for complication because they think that, oh, that will never happen. That can never be my portion. At the end of the day, they won't bring what they need. And even when there is need to do something, because they are not prepared, they don't prepare for fun, it might take some time, which might jeopardize their health. The physical and the social environment, all these also affect the health. The kind of the house the people are living, the kind of the air in that environment, like people living in industrial area, they tend to have some issues because of the films being produced in those industries. And like people working in some areas, they tend to have some conditions. And also the kind of environment that children are raised, like children being raised in ghetto, they have been exposed to alcohol at a very tender age, exposed to cigarette smoking, exposed to some kind of life, you know, that can jeopardize their health. So all these are determinants of health, and they really, really have effect on health, according to research. So they impact on health outcomes, and they also cause inequality. And that's why some people could enjoy some things more than others, because maybe they have access to those things that is needed to improve health. So all these have to be addressed in order to prevent ill health and in order to promote the health of the population. We also talk about ethics in public health. And this ethics involve equity and justice. That is, people should be given rights and access to quality health, irrespective of their social status, irrespective of their level of education. Then autonomy. They have right to decide over their health. Beneficence, that is, the public health is about doing good to the health of people. No malfeasance, not be involved in harm. Respect for human rights. It is one of the core principles of ethics that for every human, they have their right, which has to be respected, which should not be jeopardized with. Then, like I said, accountability and transparency for whatsoever is being done. For if there's any the need for any trials. It has to be documented. It has to be transparent. Then we have to balance individual rights also with population health. These are some ethical dilemmas in which sometimes as much as people have right to confidentiality, there might be need sometimes to divulge some information so as to also protect the health of the population. So these are the ethics dilemma in public health. So what are the importance of public health? Number one, disease prevention and outbreak control. It prevents diseases. It prevents outbreak. You know, before when there is an occurrence of a disease, public health swam into action. The professionals there swam into action, thereby trying as much as possible to carry out surveillance, to be able to detect on time and not that thing and prevent its spread. So public about disease prevention, they also control outbreak of diseases. It's also improved life expectancy. You know, by the time that people have access to quality health and those things that will promote their health, their life expectancy will improve. They reduce health inequalities. It provides environmental and occupational protection. You know, there are some safety precautions that has to be put into place in every workplaces. So it is the public health that is doing this. Then it helps in emergency preparedness. About preparing for emergency. The emergency don't have to occur before we prepare. We would have prepared. Like in case of emergency, maybe in case of fire, these are the things that has been put into place to minimize its effect. Then economic and social development, you know, like they always say, the nation health determines the nation's wealth. For those population that is enjoying quality of health, then vice versa, their economy will also improve. Then it's also about evidence-based policy and decision-making, like I've said. Policies are not just being created. They are being created due to evidences, due to researches. So those are the things that public health gets involved with. Then public health in practice. What are the things that we do in public health? The first thing is health education and advocacy. Health education, these are the major things that we do in public health. We educate people about a certain diseases, its prevention, how to promote the health, how to rehabilitate the health of people that is already having issue. Public health is mostly about health education. You know, we do hear a lot of jingles in the radio, through media, even now through digital interventions about education about one thing or the other. And we advocate for people's population health. We advocate for people's health. Like sometimes we hear about breastfeeding, exclusive breastfeeding. Sometimes we hear about birth preparedness and complication readiness, family planning, prevention of maternal mortality, reduction of neonatal mortality, and so on. Prevention of child sexual abuse, and so on. All these about health education and advocacy. Then surveillance and monitoring, like I said the other time, if there is an outbreak, or even before an outbreak, there is always surveillance. Then there is monitoring. How is this? There are some forms that has to be filled every month concerning some diseases, and they do monitor it. Then public health also is also about emergency preparedness, such as control of fire outbreak, control of infectious diseases such as cholera. So we get prepared. Okay, if this should happen, what are the things that have been placed on ground? It's not that when that thing happens, that we have to be running helter-skelter. Public health is about emergency preparedness, being prepared for emergency. So, what is public health about? From all this, we can see that public health is about prevention focused. That's the main thing. It's about prevention focused and population based. It focuses on prevention of diseases, promotion of health, and rehabilitation of those that have one chronic disease or other. And it's population based, like I told us the other time. It's not only about, it's not about individual, it's about the population of a particular of a particular concern. Then another thing is that strong system for public health require multi-sectoral collaboration. As much as we are talking about public health, there are other sectors that has contribution to public health. And many of them, such as water, such as food security, agriculture, housing. We have talked about housing here. Even about employment and many other things. So public health requires multi-sectoral collaboration. And I also talked about the social determinants and ethics being the center of public health. They are the center of public health. All these social determinants has to be worked on if you really want to promote the health of the population. And it's very, very important that the ethics are also considered. What you are doing, is it going to be of benefit to the population? Is not going to harm the population? Then the people has right to choose. They have right to say they want to go on with it. So that is it. Then public health drives sustainable development. Another thing about public health is that it's not about just doing it for people. It's about ensuring that that thing will be sustainable. Not just about doing it. Whatsoever it is that we are providing has to be sustainable. So the slogan of public health is that prevention is better, cheaper, and more effective than cure. So those are the major things that we should take on about public health. Now we are going to go to mental health awareness program. So now, the first thing that we are going to talk about is foundation of mental health. What is mental health? It's a state of emotional, psychological, and social well-being. That is, that person, this one is talking about the emotion, the psychology, and the social well-being of that person. That is, how that person is able to balance and cope with stress, work productively, and contribute to society. And mental health is about mental well-being across the life course, not just about some individual, not just about adults. Mental health involves even from day one till very old, till death. Let me say that. And mental health is not just the absence of mental illness, but it's about balancing the state of emotion, the psychological and social well-being of individual, and developing ability to cope with stress, ability to work productively, and contribute to society. So that is what mental health is all about. It's about maintaining that state of, so that is what mental health is about. While mental illness is when someone is raising hand. Someone is raising hand. What part is, well, I think the admission. How could I attend to that person now?
Oh, ma, you can continue, ma. Sorry about that.
Okay. So now, mental illness is about clinically diagnosable disorder that affect the thinking, the mood, and behavior. Now, when we are talking about mental health the other time, we said that the state of maintaining emotional, psychological, and social well-being, balance, ability to cope with stress, work productively, and not absence of illness. Who is writing? Olakanmi Abelasukanmi is writing on my page. Ola Obasomi is writing on my page. Please, I guess that's a mistake. So now, why mental illness, as we are saying, is clinically diagnosable disorder that affect thinking, the mood, and behavior. That is when we are not talking about illness. That is, that person has been clinically diagnosed to have disorders that is affecting his thoughts, his mood, or his behavior. So, before we go on, we want to talk about the historical and global perspective to mental health. At the ancient time, it is believed that mental health is caused by supernatural causes alone. There is people that inflict people with mental illness, or it is when someone has offended God that made one to have mental illness. But later, by the Middle Ages, another thing began to crop up, that whosoever has mental illness should be isolated. They would tie them or put them in a room, lock them there, be serving them food sometimes, and even they might not give them, even serving them like animals. So later, about 18th to 19th century, they think of having asylums whereby they keep these people that is having mental health. But not really that they are even giving them drugs, but they just put them there. So, and be treating them, giving them a kind of moral treatment that, oh, this is what you should do. But now in the modern area, there is now the provision of medical intervention for people that have mental illness, and psychological and even community care. So it has transferred beyond just keeping them. It's not about provision of medical treatment, about they give medicine, or even psychological, and even provision of community care. So that's the evolution of mental health. Now, globally, like we know, we have talked about public health. Mental health is also a public health priority. You know, it's not about of public health concerns. It is now of public health that people should have good emotional, psychological states, and they should be able to cope at workplaces and with stress and behave normally. So mental health is now a public health priority. And also, WHO has advocated for integration of mental health into primary care. And we can see it now at our PHC. We do have mental health nurses who provide care to those that are having mental illness, because it has now been according to WHO policy, it has not been integrated that, okay, in order to prevent stigma attached with mental health, that let it also be in the primary healthcare setting, whereby they promote the mental health of people and also provide some things for those that have mental illness so as to reduce stigma with mental health. Then, also now, they have also noticed the cultural influence on perception and treatment of mental health. You know, like what you are saying, that if culturally we can try as much as possible to reduce stigma and discrimination, we can perceive mental health as, like I always say, it's like disorders to happen to any, like every other disorders that happens to every woman. You know, people have malaria. That is disorder that is affecting this body because that person has been bitten by an Anopheles mosquito and malaria parasite has been transferred to that person. So now the global perspective is that we should change the perceptions to mental health. You shouldn't just see them as, oh, this person, because he's having this, you should not touch me, you should not do this. You should change our perception. And we should see it as something that can be treated and something that can be well managed. What's happening? So, like I said, globally now is about changing the cultural perception to mental health. So, it's about reducing mental health stigma and discrimination. Reducing stigma and discrimination to people that has mental illness. So, what is stigma? It refers to negative attitudes, beliefs, and stereotypes towards people with mental health condition. I know now a lot of, as many of us, if we happens to know that someone has been mentally ill, some of us initially, maybe before this program, might be having a kind of sentiment towards it. But like it's been said, it's like any disorder. It's just that that disorder has to do with the mental capacity. It has to do with the brain now. It has to do with the mind. So how would we feel if because of whatsoever, because of malaria, and people begin to treat us? Like I could remember, one of my cousins traveled from Nigeria to develop world. On getting there, she had malaria. And she was talking about how they were treating her, that they have to wear boots, they have to put on socks, I mean gloves, masks, and everything before coming to treat her. And, you know, she was not feeling well about that. She said, if you see the way they are treating me, as if I'm having something so serious. And I'm using that to now see the way we also look at people that are mentally ill. That is stigma, you know, the kind of attitude, no, this person can do this. So this is stigma, negative attitude, belief, or stereotype where we behave in a particular manner to poor people with mental health condition. So what could be types of stigma? It could be public stigma, it could be self-stigma, it could be institutional stigma. That is, public stigma is the one that public has towards them. Anyone that has mental illness, oh, don't move it. They can harm, they can. No, you cannot even give them work. Self-stigma, that's by the individual. The institutional stigma is the kind of stigma that is being put on them by institution. Like some institution, if they know that people that live with mental illness apply for job, they may not give it to them. we shouldn't be, because they are human beings like us. It's just that they are having mental health disorders. So what could be the effect of this stigma? It delays help seeking. When people knows that if they come out and say, I'm having this, I'm having that, there will be stigma and discrimination. They will not seek help on time. And I noticed that most cases when people are having some challenges, I ask them, maybe you should go to Arrow for treatment. Many of them will say, Arrow, okay, don't worry. Delaying help seeking. Another thing is social isolation. They may not want to deal with people. They may be isolating themselves, thereby worsening the situation. Another one is discrimination at workplace, in the educational sector, where they are at their place of studies, and even among healthcare. There's also discrimination, even among us, that we all to prevent this. So as we have determinants of health, also we have it in mental health, determinants of mental health. What are the determinants of mental health? It could be biological. That's number one. Genetically, some people are prone to mental illness. Sometimes it runs in the family. Sometimes it can just be due to the brain chemistry, whereby some brain chemistry will not work well, like maybe increased level of serotonin, dopamine, and all those things. And sometimes physical illness can also lead to it. Like for some people that has been having some chronic diseases, later due to that chronic disease affecting them, they may now begin to have depression and some other things. And even also some conditions like typhoid will also lead to mental health. I know there's evidence we would have heard about typhoid psychosis. So this could be part of what could lead to. Then psychological determinants of mental health. The coping skills. Some people do not have coping skills. They don't, immediately they are exposed to some conditions, they couldn't cope. They lose it easily. Then self-esteem. With lower self-esteem, it has been shown in evidence that people tend to have mental issues. Then inability to regulate our emotions. Those that are very emotional, they are prone to have mental illness easily. Then it could be social. Wow, this is very, very, also very urgent. When there is no support, it has been found out that whether family support or sometimes it could be other social support, when there is support, people tend not to have mental illness on time, even when serious issues happen. Like sometimes due to bereavement, some people might want to have, but seeing a lot of people surrounding them, consoling them, giving them support, both moral, spiritual, they tend not to have it. So family support is very significant in preventing mental illness. Then education. As much as we are aware and exposed to some education, it prevents us from having mental illness. Like coping skill. If we have been educated with how to cope with situations, If a coping skill has been developed, then you might not, or that person might not quickly have mental illness. Then poverty is also linked with mental illness. With poverty, there's increased rate of mental illness. And violence too. Violence of any type. Even children that are being exposed to violence, maybe see their father beating their mothers, or in the environment they are living, people beating themselves and all those things, they tend to have mental illness. Another one is that environmental, the living conditions of individual also exposes them to mental illness. People that are living in low socioeconomic status may quickly have mental illness because they may not have support that they needed in cases of psychological issues. Then the healthcare access too, like is now been an act that mental health is now being promoted even at PhD. So people with that, and that's why it's mental health is being taken to PhD, so as to increase people access to mental health. So with healthcare access, with increased access to healthcare, it decreases mental illness and promotes mental health, because we are going to be educated on those things that can promote our mental health, such as ability to cope with skill with challenges of life, management of stress, management of our time, and many other things. With all those things, you'll be able to this you are writing on my screen. Then culture. Please, you are writing on my screen. Culture too. Culture. In culture, where some culture might believe that no, you don't take them to hospital. Just keep them at home. Be beating them. It is caused by spirit. Just be beating them. Those may also affect the mental, may make those that are having mental illness not to come out on time. So all these determinants across our life course are prone people to mental illness. So people that are being exposed to some conditions or the other, and if it is not well managed, or they don't have family support to help them, they tend to develop mental illness. For those that have support and have every other thing that is needed, they tend to promote their mental health, thereby preventing mental illness. So how could we promote mental health at individual level, like we have talked about? Stress management. Very, very important. When someone is exposed to stress, how is the person seeing it? What are the things the person can use to minimize the stress or do away with the stress? Okay, if that stress cannot be done with, what are the things that we need to build up to cope with it? So that is very important. Then healthy lifestyle promotes mental health. Alcoholism do not help mental health. Use of drugs and substance abuse will never help mental health. Just thinking continuously will never help mental health. Not sleeping enough will not help mental health. All these are things that affect their resilience. At individual level, if one can build resilience, that is, resilience, the ability to cope on, even when there are challenges. So with people that have high resilience, they tend not to come down with mental illness, because they have determined to face and challenge to face and challenge and improve their mental health. Then at the community level, what do? We create awareness campaign about those things that can promote mental health and prevent mental illness. We give social support. We also, at community level, we talked about people giving social support to themselves. Then we advocate for those that are having mental illness and even that are having some other issues, so as to prevent stigma and discrimination, so that people can promote self-seeking lifestyle. So we do this at community level. Then at health system, what do? Early detection. Do you know that normally, even in other health institutions, apart from mental health institutions, it is expected that even when someone is something and they notice something, there's some kind of things that they also use to assess that the person is not having mental illness. Then another thing is integrated of services. That's what WHO is saying, that mental health should also be at all levels, especially even at the primary health care. So that for those that do not really need the management of higher institutions, they can come to primary health level and be taking their drugs and be taking their treatment and just be going, and nobody will be able to stigmatize or discriminate them. Then there is need for trained workforce. The people that is providing mental health care should be professionals. They should be trained, not just anyone. Another thing that is being done is...
Hello, ma'am.
Hello?
Thank you so much, ma'am. So we just have 15 minutes left for the training before we go into question and answer section. So you can just help us to wrap it up so fast. Are you there with me, ma'am? Are you there with me?
I'm hearing now.
Yes, I said we just have 15 minutes for the lecturing.
15 minutes more?
In the 15 minutes more, yes. So that we can start.
Okay. Okay.
Yes.
So
okay.
Let me. All right.
All right. You're welcome.
Okay. Thank you, sir. Okay. What are the kinds of mental health disorders? The common one: anxiety disorders, depression and mood disorders, bipolar disorders, schizophrenia. This is very serious. And psychotic disorders, personality disorder, and general management of this is giving of psychotherapy, medication, and psychosocial support. So these are the mental health challenges at child and adolescent health. There are some mental health that come at developmental stages, the behavioral and emotional disorder, learning and attention disorder. Some children, they will not be able to learn. They may be having problems at sitting down at the place. They may be having disorders. Trauma and adverse childhood experiences. This one affects children. So it is better to early identify and intervene on time. So in most cases, what do? We try as much as possible also to help people to develop coping mechanisms and prevent suicide. With some mental health disorder, there is suicide is common. So we try as much as possible to prevent suicide. We have talked about substance use and behavioral addiction. So this is part of mental health disorders. There is mental health legislation that talked about the acts and the human rights of people with mental health. Then it talks about ethics in mental health. The same ethics that applies to them. They have rights, especially when they are in their good state. They have right to decide on what they want to do, and you should do no harm to them. Then community advocacy and awareness, referral system, like I said, for those that have been referred to as an institution, as much as possible, when there is no need for such management again, they should refer them back to primary care. So mental health is everyone's responsibility. We are called to promote its awareness, reduce stigma, and support help seeking. So we are to promote this awareness among people, and we should not be part of the people that will be stigmatizing or discriminating against them, so as we can support them to seek for help on time. So we now quickly want to talk about advanced caregiver training. So, who is an advanced caregiver? A person that's a trained professional to provide holistic care. And this can be to support the elderly, the chronically ill, the disabled, or recovering clients. These are people that need long-term care. So this person works collaboratively with healthcare professionals. They don't work independently. And it focuses on dignity, improving the dignity of the people and their independence and quality of life. So they monitor and report changes in their condition. They provide emotional support and companionship. They maintain safe care environment. They account for actions and decisions. So what's the professional standard and scope of practice? To maintain competence and professionalism at all times. The person must always develop him or herself so as to maintain competence and professionalism, respect client rights and choice, effective communication among the team. They understand tasks within the scope and outside the scope. They avoid those tasks that are outside the scope, such as diagnosis, prescribing, or invasive procedures. This is very important. So, what is the ethics and body and code of conduct? That to respect dignity, as we have said, autonomy, the person has right to decide, and justice, whatsoever we are doing. Can we say that it is right? Then we have to maintain confidentiality at all times. Then we should set clear professional boundaries. For the mere fact that we are giving care does not mean that we should not have personal, we should allow our personal interests to be overriding. It is professionalism. You ought to maintain the professional boundaries, not to now be behaving as if you have become the family of the person you are giving care to. You seek guidance when you are faced with ethical dilemmas. Another thing is respect culture, the religious and personal value of that person. Provide equitable and inclusive care. Understand the duty of care and negligence. This should be avoided. Report case of abuse and always obtain informed consent when it is needed. You don't just do anything. You seek for the consent of that person you are giving care to. What are the personal care, hygiene, and skin care that we do? You have to support bathing, grooming, and toileting of that person. You have to maintain privacy and dignity. You have to prevent infection through hygiene. And you spacing and prevent pressure injury. Because those people some of them might be bedridden. So they have conditions that prone them to pressure injuries. So how do we ensure mobility, transfer, and fall prevention? By encouraging self-mobility. We don't just leave them. We assess their condition, and we provide the kind of mobility they could do. Then, using proper body mechanics to carry so as not to promote, so as to prevent fall. Then apply safe transfer techniques. There are techniques that we use in transferring patients. You identify and you reduce fall risk by putting necessary assisting device to bedside and to prevent the patient from falling. So, about their nutrition, their feeding and medication support. You support them with balanced nutrition and hydration. We assist with safe feeding. We feed them. Depends on the kind of, on the condition. Then we follow their rights of medication, that it is right dog to right patient, through right food, and through at the right time, and at the right. And we observe and report in cases of side effect. Another thing is that we should also recognize their mental health challenges. Like when we are talking about mental health, sometimes it also happens among, like I told you, physical causes. Chronically ill people tends to have mental health challenges. And if this is not taken care of, it can lead to mental illness. So we should also support dementia, and cognitive decline. Sometimes some people, the elderly, they may be having dementia, so we support them and prevent cognitive decline. Then we provide emotional support and companionship. That's one of the reasons we are there. And we manage challenging behaviors calmly, not rudely. Then to prevent infection, apply infection prevention practices such as maintenance of aseptic technique when it is needed, hand hygiene, environmental hygiene, safe practices, and many other things. Then we also support chronic disease management, like I said, depending. For those that are chronic disease, we manage it accordingly. Then we provide comfort and symptoms relief. Then we support family during end of life care. For those that, that have one challenge or the other that we know that it might lead to death, we also support their family. So we prepare them. Then we are to communicate clearly and empathetically. As caregiver, you are expected to communicate clearly and empathetically. You cannot sympathetically. Empathetically. You do what you need to do, but putting yourself in consideration. Like if I am to be the person, how would I want that person to behave to me? Then we document care accurately and timely. Not before we give care. Not after long we have given care. We document what we have done and on time. We protect confidentiality and data, very important. We don't expose our clients. Then you advocate for the client's rights and dignity. So what is the key takeaway? So as professional caregiving saves life, serves dignity, and it requires competence, compassion, and ethics. So all this has to be put into consideration as professional caregiver. Thank you very much. Thank you.
Thank you very much. That
Thank
was a
you,
very
ma.
wonderful
Thank you, ma.
lecture.
Thank you.
I really
Thanks for the
appreciate it.
lecture.
Thank you very much, ma, for the lecture.
All right. Thank you so much, ma. We really
Thank
appreciate
you.
you from our hand here. Yes,
Thank
because of
you
our
so much,
time, we're
ma.
going to commence directly into the training tonight, into the questioning and answer.
God bless you.
Is it unmuted?
Now,
Thank you, ma.
back to the questioning and answering section. Are you there, everybody?
I'm there, but I'm not hearing very well. Okay.
Okay, can you hear us now, ma'am?
Yes, I'm hearing now.
Okay, because of our time, we are trying to round it up because of our time. Or do you still have any, lecture to give before I round it up with a question and answering section? Is there anything that you still want to say, ma'am? Can you hear me, ma'am?
You said,
Okay.
do I have any other things to?
Is there any other thing to share before we welcome questioning and answering section? All right, thank you so much. We really appreciate that, ma'am. Now let's come back to the participants. We really appreciate you, ma'am. More strength to you, and you'll be able to deliver more to people. Now, let me see. If you have a question, we are now in the questioning and answering section. If you have a question, kindly check the reaction box. Raise up your hand. If you have a question, raise up your hand regarding the lecture that has been dished out tonight. If you have a question, just check the reaction box. Raise your hand. Let me see. We just need like 2-3 people before we round up this section tonight. If you have a question, just raise up your hand.
It's what Timina no Kunyanko Konko. Mamma, you need to help to the banga.
If you have a question, okay. If you have a question, just raise your hand up. We have
Hello,
just
sir.
5 minutes for that.
Hello, sir.
You are welcome. Hello, good evening.
Hello, sir.
Yeah, we can
Good
hear you.
evening.
Good
How are
evening.
you?
Yeah, we are good.
Good evening, sir. How are you?
Yeah, we are good. Go on with your question if you have a question. But next time you go to the reaction section, you raise your hand before you held your question. We are with you.
It does.
It does.
All right.
To the first
Now,
match.
is there any question before we run the section up? Okay. Let me see.
So you got, I hope you even want to
Oh, goodness. Okay. Okay. Please let's mute our mic. In the absence of none, we don't have any questions. So let's see.
Those that are not asking questions, can they please mute? Because I'm hearing a lot
Please
of
mute your
voices.
mic, please. All right. So now, if you have a question, just raise your hand. In the absence of none, I think we are going to proceed to the end of tonight's webinar. And once again, we really appreciate our facilitator tonight, the person of Adiola, Mrs. Adiola Taiwo Oyedele. She's a lecturer from Ogun State College of Nursing. We appreciate you, and your time is very important and vital. Thank you so much tonight. And also to the organization, we really appreciate you for bringing this training on board for everyone. We appreciate you. Also the president, we appreciate you. The training providers, I can see your presence, we appreciate you. The facilitators, thank you. Now back to the facilitators. Now tonight, we will advise you to go back to your classes. Your facilitators are there waiting for you. If you have any questions pertaining how to get your certificates, they are there for you to respond to you. So payment for certificates is ongoing, and in 72 hours time, the certificate, the discount price will return back to normal. So please utilize the opportunity, make use of the opportunity to get satisfied for the training as it is now. This training may not come on board throughout this year. This may be the only time for this year based on the calendar, and probably December or January next year, the new edition will come on board. So make use of this opportunity to get your certificate, reach out to your facilitators, and I believe the account details have been posted in your various classrooms. Thank you so much once again. We appreciate you, our facilitator tonight. And also, I remain Ambassador Ikuomola Matthew Adeshegun. Thank you so much and remain blessed. So also, and at the same time, the test link also will be released too. So hopefully tonight, or probably tomorrow morning because of the time. But just make sure you reach out to your facilitators. They'll be able to give you the necessary information needed. And at the same time, make sure you secure your certificate. Thank you and remain blessed. Good night, everybody.
Hello.
Yeah. Okay, do you have a question? You should have raised your hand earlier.
Yes,
Okay.
no, I'm there. Please, I want to find out for the certificate. For those of us
introduce yourself first. Introduce yourself
yes,
first.
my name is Catherine. My name is Catherine Ikpeju.
All right.
I want to find out the certificate. How much for this lecture now, for this webinar that we are just for on health care, on mental health. How much is our certificate?
What happened? All right. Thank you so much. This is it. If you've been following your facilitators, both for the webinar, both for the section right from the day one to now, your facilitator should have posted it in your group by now. if you've been following your facilitators. So check your reach out facilitators. They will respond to you on the amount. So just reach out to your facilitators. So both for the webinar and is the package.
Okay.
That is for the discount price. I think I've responded to that.
Okay.
Okay. All right. So if you have any other questions in absence of that, none. So let me see, is there any other person? Okay, none. So let's go back to our various classrooms.
My hand was
Let's reach
off.
out to our facilitator. Your hands, okay, let me see.
Yeah.
Because of the time, you are trying to. Now,
Okay,
let me just give you
I'll be quick.
a chance.
I'll be quick, sir. Okay, so
All
for
right,
those that
okay.
actually didn't join when the classes started, can we still do the go and watch those lectures, do the assignments, and still follow up to pay off for the certificate? Is that okay?
Exactly. Yes, exactly. So just follow. That was the reason why I said that just reach out to your
Sorry, sir.
facilitators.
Sorry.
Just be patient. Let me respond to these questions. Once I'm done, I'm going to ask you to talk. Now, the last question that was raised, go back to the same answer. Reach out to your facilitators. The assignments are there for you. Once you take the assignments, make a submission to them, submit it in your various group, and reach out to them that you want to get your certificate. They will provide your certificate for you after payment. So now let me get back to you. So what is your name? Let me just hear from you because of the time. Are you there now? I can see your hands up again. Let me see your hands. I can see your hands again.
Close this door, Joe.
Okay. Ask question, please. I want to know is this
Hello,
certificate global accepted or recognized globally? That is one. Two.
Yeah,
Can we also have slide of these?
Okay. If I should
Is
get
it
your question
globally
clearly,
accepted?
what is it?
Is the
That is it recognized globally?
I mean, is the certificate? Yes. And secondly,
Yes.
can we have
Now,
a kind of can we
I
have
think
the
your
slide
network.
of the lecture tonight?
Can you have a slide, right?
Hello, good evening, sir.
Yeah, that's the
All right. Let me respond to that
Hello.
question. So we have just 2 minutes to respond to that. Now, number one thing is this. If you've been following up with your facilitators, we asked them to post the accreditations in their various classes. And at the same time, for you to confirm the accreditations, you can type New Global Services on the internet, make research on your own, then come back to your facilitators. I think I've made justice to that. But as it is, what's it called? The accreditations have been sent to your facilitators so that they can forward it to you. Thank you. So is there any other person? Let me just take one more question before we round it up. One more question.
Thank you, sir.
Okay.
No other questions. Good night. Thank you. Thanks
All
for
right.
the training.
Thank you so much.